Hello and welcome. Today we're diving into a condition called pleural metastases. This refers to the spread of cancer to the pleura, the lining surrounding the lungs. While it's not a primary lung cancer, it represents a serious development for individuals with other forms of the disease. Join us as we explore its causes, symptoms, diagnosis, and treatment options. So, what causes pleural metastases? Primarily, it occurs when cancer cells from a primary tumor elsewhere in the body travel through the bloodstream or lymphatic system and settle in the pleura. The most common primary cancers that metastasize to the pleura include lung cancer itself, breast cancer, lymphoma, ovarian cancer, and melanoma. Less frequently, cancers from the gastrointestinal tract, kidneys, or other organs can also spread to the pleural space. Let's understand the underlying mechanisms. When cancer cells reach the pleura, they begin to multiply and form tumors. These tumors irritate the pleural surfaces, leading to inflammation and increased fluid production. This excess fluid accumulates in the pleural space, resulting in what we call a pleural effusion. The effusion compresses the lung, impairing its ability to expand fully. The inflammation and tumor growth also disrupt the normal function of the pleura, further contributing to breathing difficulties and other symptoms. In some cases, the cancer can directly invade the chest wall or other structures within the chest cavity. Understanding how often pleural metastasis occurs is important. Unfortunately, precise numbers are difficult to obtain, as pleural metastasis is often a late-stage manifestation of cancer. However, studies suggest that it's a relatively common finding in patients with advanced cancer, particularly those with lung, breast, or ovarian cancers. The incidence varies depending on the type and stage of the primary cancer. It's crucial to remember that while data provides a general picture, each individual's situation is unique. What are the signs and symptoms to watch out for? The most common symptom of pleural metastasis is shortness of breath, also known as dyspnea. This occurs because the pleural effusion compresses the lung. Patients may also experience chest pain, which can be sharp or dull and is often worsened by breathing or coughing. Other potential symptoms include a persistent cough, fatigue, weight loss, and hoarseness. It's important to note that these symptoms can also be caused by other conditions, so it's crucial to consult with a doctor for proper diagnosis. How is pleural metastasis diagnosed? The diagnostic process typically involves a combination of imaging tests and fluid analysis. A chest X-ray is often the first step, which can reveal the presence of a pleural effusion. A CT scan provides more detailed images of the chest and can help identify tumors in the pleura. A thoracentesis, which involves inserting a needle into the pleural space to withdraw fluid for analysis, is a crucial diagnostic procedure. The fluid is examined under a microscope to look for cancer cells, and other tests can be performed to help determine the source of the cancer. A pleural biopsy, where a small sample of the pleura is taken for examination, may also be performed to confirm the diagnosis. While not strictly classified into types, pleural metastases can be categorized based on the extent of involvement and the type of primary cancer that has spread. Some patients may have only a small amount of pleural fluid, while others may have a large effusion that significantly compresses the lung. The specific characteristics of the cancer cells found in the pleural fluid also help determine the primary source of the cancer. The treatment of pleural metastasis is focused on managing symptoms, controlling the spread of cancer, and improving quality of life. Treatment options may include thoracentesis to drain the pleural fluid, pleurodesis, which involves creating adhesions between the pleura to prevent fluid from reaccumulating, chemotherapy, radiation therapy, targeted therapy, and immunotherapy. The specific treatment approach depends on the type and stage of the primary cancer, the patient's overall health, and the extent of the metastases. Palliative care, which focuses on relieving symptoms and improving quality of life, is also an important aspect of management. Unfortunately, there's no guaranteed way to prevent pleural metastasis entirely. However, early detection and treatment of the primary cancer can reduce the risk of spread. Maintaining a healthy lifestyle, including not smoking, eating a balanced diet, and exercising regularly, can also help to reduce the risk of cancer in general. Regular check-ups and screenings are important, especially for individuals with a family history of cancer. The prognosis for patients with pleural metastasis varies depending on several factors, including the type and stage of the primary cancer, the patient's overall health, and the response to treatment. In general, the prognosis is guarded, as pleural metastasis indicates advanced cancer. Recent research is focused on developing new and more effective treatments, including targeted therapies and immunotherapies, to improve outcomes for patients with pleural metastasis. Scientists are also exploring ways to detect pleural metastasis earlier, which could lead to more effective treatment. We hope this overview has provided a better understanding of pleural metastases. Remember to always consult with healthcare professionals for personalized advice and treatment.